Welcome to our deep dive on ECPR.
Ooh, exciting.
It is. We're going to be looking at some recent insights from a medical review article all about this cutting edge technique.
Mm.
If you're curious how it works when it's used and you know where things are headed, you're in the right place.
It really is amazing how this technology has evolved.
Yeah.
It started as a last-ditch effort in the 60s.
Mm-hmm.
It's now being used in thousands of cases every year,
Yeah.
but it is a complex procedure,
Right.
ECPR,
Right.
with some significant resource implications. So understanding the nuances is key.
Yeah. So let's get into it. What exactly is ECPR? Paint us a picture.
Okay, so imagine a machine taking over temporarily for your heart and lungs.
Okay.
That's essentially what an ECMO machine, the heart of ECPR, does.
Okay.
It circulates and oxygenates your blood,
Okay.
giving doctors precious time when your heart has stopped.
So it's kind of like a high-tech bypass machine during a cardiac arrest.
That's a great analogy.
Okay.
ECPR stands for Extracorporeal Cardiopulmonary Resuscitation, and it does involve using a type of ECMO machine called a veno-arterial ECMO.
Okay.
You might also hear it called extracorporeal membrane oxygenation or extracorporeal life support.
Okay.
And this is used during a refractory cardiac arrest,
Mm-hmm.
meaning a cardiac arrest where traditional CPR just isn't enough.
Wow. So this is like happening right now, not just in research labs.
Absolutely.
Wow.
In fact, over 15,000 cases are registered in the ELSO registry,
Okay.
which is the Extracorporeal Life Support Organization,
Okay.
with a 30% survival rate.
Wow. 30%. That's higher than I would have expected.
It is significantly higher than traditional CPR in many of these situations.
Wow. So why is it used? When do doctors decide to go for it?
Well, survival rates after cardiac arrest are generally pretty low.
Yeah.
The longer the brain and other vital organs go without blood flow,
Mm-hmm.
what doctors call low flow duration, the worse the outcome is likely to be.
So minimizing that low flow time is what it's all about.
Precisely. ECPR aims to buy time by restoring blood flow to those vital organs, especially the brain. Traditional CPR, even when done perfectly, only achieves about 25 to 30% of normal cardiac output.
Which isn't enough to sustain the brain.
You got it. After just 15-20 minutes of traditional CPR, the chances of survival with good brain function plummet to around 2%.
Wow.
ECPR can bridge that gap. It gives doctors time to address the underlying cause of the cardiac arrest while keeping the brain and other organs oxygenated.
So it's not just buying time, it's actually giving the body a fighting chance to, bounce back.
Absolutely.
Okay, I'm intrigued. But how does this whole setup actually work? Walk us through it.
Okay, so it all starts with cannulation, where large tubes are inserted into major blood vessels, usually in the groin.
Okay.
These tubes are connected to the ECMO machine, which then takes over the job of circulating and oxygenating the blood.
So you're actually rerouting the entire bloodstream through this external machine?
Yes,
Wow.
and there are two main cannulation techniques, central and peripheral.
Okay.
Central cannulation requires open heart surgery, which isn't feasible in an emergency situation.
Right. Too slow and every second counts.
Exactly. Peripheral cannulation done through the groin is much less invasive and the go-to method for ECPR.
Okay, I'm curious about timing. How long does this cannulation process take?
That's a good point. Time is of the essence.
Yeah.
An experienced team, about 10-15 minutes.
Oh, wow. That's actually quicker than I imagined. But still a pretty tight window.
Yeah.
What happens once the tubes are in place?
Okay, then the ECMO circuit takes over. Think of it as a highly sophisticated system with a pump, an oxygenator heat exchanger, and a sophisticated interface to monitor and control everything.
Okay.
This machine can pump up to 6 liters of blood per minute.
Wow. That's a lot of blood. So to clarify, the oxygenator basically does the lungs job and the pump takes over for the heart.
You got it.
Wow, that's a pretty miraculous piece of technology.
It is.
But I'm guessing there must be downsides or complexities to consider.
Absolutely. One of the biggest challenges is patient selection, figuring out who will truly benefit from ECPR.
Yeah.
And there are inherent risks involved, of course, such as bleeding blood clots, potential organ damage.
So it's not a decision to be taken lightly. What are some of the biggest factors that doctors consider when weighing, the pros and cons of ECPR?
Well, as we discussed, low flow duration is the most crucial factor in ECPR success.
Yeah.
The faster they can get that machine hooked up, the better the chances are.
Makes sense. Less damage means easier recovery.
Exactly. But think about the logistics involved getting the patient to a hospital equipped for ECPR.
Right.
Having a specialized team ready to go.
Yeah.
It's a huge undertaking.
Yeah.
And it raises some ethical questions, too.
Yeah.
Is it right to use ECPR when the chances of a good outcome are slim?
That's a tough
It
question,
is.
for sure, especially since even with ECPR, the mortality rate is high.
You're right. According to the ELSO registry, the mortality rate is around 70%,
Wow.
which is a sobering statistic. It takes a toll on everyone involved.
Yeah. So how do they even decide? What are the criteria for considering someone for ECPR?
Okay, so the ELSO has suggested some guidelines,
Okay.
but there's still a lot of debate in the medical community. Generally, they look for people under 70
Okay.
who had a witnessed cardiac arrest,
Okay.
received CPR almost immediately,
Okay.
and whose heart stopped due to a potentially treatable cause.
So someone relatively healthy who had a sudden, unexpected cardiac arrest.
Yes, but keep in mind there are always exceptions.
Right.
The decision to use ECPR often has to be made very quickly,
Yeah.
based on limited information,
Yeah.
all in a very high pressure and emotional situation.
Wow. That puts a lot of pressure on that medical team.
It does.
And speaking of timing, you mentioned getting someone on ECPR quickly is key.
Yes.
Is there a sweet spot for making that transition from traditional CPR to ECPR?
That's a great question. And that's where things get really interesting.
Okay.
On the one hand, we know that minimizing low flow duration is critical.
Yeah.
So starting cannulation for ECPR as early as possible
Yeah,
seems
do it.
intuitive.
Beat the clock, get that blood flowing.
But there's a catch.
Okay.
Doing ECPR too early carries the risk that you're putting someone through an unnecessary and highly invasive treatment.
Right.
Some patients might have recovered with traditional CPR alone.
So it's a delicate balance between acting quickly and avoiding unnecessary risk.
Exactly.
Okay.
There's a lot of research focused on finding that optimal transition time from traditional CPR to ECPR.
So are there any hard and fast rules about when to make that switch?
Unfortunately, it's not that simple.
Mm-hmm.
Different emergency medical service systems have different approaches.
Okay.
Some prioritize a stay-and-play approach where they try to stabilize the patient on scene,
Okay.
while others emphasize a scoop-and-run strategy, getting the patient to the hospital as quickly as possible.
So there's no one-size-fits-all answer?
Not really.
Yeah.
Data from the U.S. suggests that there's no benefit to a stay-and-play strategy beyond 15-20 minutes of traditional CPR.
Okay. So if someone's heart hasn't restarted after 15-20 minutes of CPR, it's time to seriously consider ECPR?
Potentially.
Hmm.
But even then, transporting the patient while continuing resuscitation is usually the better option. Some studies even suggest a 12-minute threshold for transitioning from traditional CPR to ECPR.
Wow. That's a tiny window to make a life or death decision.
It is. Every minute counts.
Wow.
But the complexities of each emergency system and hospital make it difficult to establish a universal ECPR algorithm.
Yeah.
Different countries and regions have different resources and ways of doing things.
So a lot of it comes down to local protocols and the available resources.
Exactly. Ideally, we would have clear time benchmarks,
Mm-hmm.
similar to the door-to-balloon time they use for heart attack patients,
Mm-hmm.
where the goal is to get them into surgery as quickly as possible.
Right. Having those kinds of targets for ECPR could really help streamline the process.
Absolutely. It could potentially improve outcomes as well.
Wow. It sounds like this is a field where every second truly does matter.
You're absolutely right.
Wow.
And even when a patient makes it to the ICU after ECPR, there's still a long and challenging road ahead.
Oh, yeah. So let's talk about that road. What happens next for a patient after ECPR?
Care in the ICU after ECPR is intense. It requires specialized equipment, a lot of expertise, a dedicated team.
Okay.
Sadly, many patients die within the first few days after starting ECMO.
Yeah. That must be incredibly difficult for everyone involved.
It is. It's a harsh reality of this field.
Yeah.
And we can't forget the stress and anxiety experienced by the patient's family during this time.
For sure. So what does that initial ICU care involve? What are the primary goals?
Well, it starts with standard post-resuscitation care,
Mm-hmm.
maintaining the ECMO machine,
Okay.
being vigilant about preventing and treating any complications.
Are there specific complications that are more common after ECPR?
One of the trickiest aspects is managing coagulation.
Okay.
To be very careful about thrombotic complications, hemolysis, and bleeding events.
Because the blood is circulating through this artificial system?
Right. Contact with the ECMO surfaces and the mechanical stress it creates can cause problems with blood clotting.
Wow.
This is a serious and sometimes underestimated complication of ECMO therapy.
Okay. What else do doctors need to watch out for?
Ischemia is another concern.
Okay.
The arterial cannula, the one returning blood to the body,
Mm-hmm.
can sometimes block blood flow to the leg where it's inserted. To
Oh.
avoid this, they often use a separate cannula to ensure that the limb is still getting enough oxygen.
It's like creating a detour for the blood to make sure the leg doesn't get left out.
Exactly.
Okay.
Then there's Harlequin syndrome.
Harlequin syndrome. What's that?
Okay, so imagine your body as a highway
Okay.
with lanes for oxygenated and deoxygenated blood.
Okay.
Harlequin syndrome is like a traffic jam
Okay.
where these lanes get mixed up,
Okay.
causing an imbalance in oxygen levels between the upper and lower body.
Wow. So even though the ECMO machine is oxygenating the blood, things can still get messed up?
Unfortunately, yes. Sometimes poorly oxygenated blood from the lungs
Okay.
can mix with the oxygenated blood from the ECMO machine,
Mm-hmm.
leading to that imbalance.
That sounds tricky to manage. How do doctors even monitor for something like that?
Okay, so they have several tools at their disposal. They use pulse oximetry on the right upper extremity to check for cerebral hypoxia,
Okay.
which means the brain isn't getting enough oxygen.
Okay.
They can also use near-infrared spectroscopy,
Okay.
or NIRS, which directly assesses how much oxygen is reaching the brain tissue.
Okay. So it's like they've got a whole arsenal of tools to keep a close eye on things,
Yes.
making sure everything's working as it should be.
Constant monitoring is key.
Okay.
And on top of all of that, we also have to consider how to best manage cardiac function.
What do you mean by that? I thought the ECMO machine was doing the heart's job.
It is to an extent,
Okay.
but it's a bit more complicated than that.
Okay.
VA ECMO primarily supports circulation by adding blood flow
Mm-hmm.
up to 6 L per minute
Wow.
to the heart's own output.
So the heart is still working even with the ECMO machine running?
Exactly.
Yeah.
Sometimes that extra pressure from the ECMO machine can actually overwhelm the left ventricle of the heart.
Okay.
This can lead to pulmonary congestion and even blood clots forming in the heart.
That's a scary thought. How do doctors deal with that?
Okay, so in those cases, they might use other devices like an intra-aortic balloon pump
Okay.
or an Impella device to help take some of the workload off the left ventricle and give it a chance to recover.
So it's really about managing the patient's entire circulatory system.
Yes.
Not just flipping a switch on the ECMO machine and calling it a day.
You're exactly right. And of course, we can't forget about the rest of the body.
Right. It's not just the heart and lungs that are affected by a cardiac arrest.
Absolutely. All the other organs have been through what's called an ischemia reperfusion injury.
Ischemia reperfusion injury. I'm not familiar with that term. What does it mean?
It means that the organs were deprived of oxygen during the cardiac arrest
Okay.
and then suddenly flooded with blood when circulation was restored.
Right.
This sudden shift can trigger inflammation and damage throughout the body, leading to what's called post-resuscitation syndrome.
So while ECPR addresses the immediate problem of the heart not pumping, it creates a cascade of other things to worry about.
Exactly. This post-resuscitation syndrome can affect any organ, the lungs, kidneys, even the circulatory system itself.
Wow.
It's a huge challenge that requires a multi-system approach.
Wow. That's a lot to unpack. Treating a patient after ECPR really does require that holistic approach.
It does.
But before we dive into, what happens next, I want to shift gears a bit and talk about the research. What evidence do we have that ECPR actually works?
That's a crucial question.
Yeah.
And that's where things get a little tricky.
Okay.
Animal studies are limited,
Right.
and the human data is still emerging.
Okay. So let's start with the animal studies. What have we learned from them?
Honestly, there aren't that many animal ECPR studies out there.
Okay.
A recent review found only 37 relevant studies, most of which were done on pigs.
Okay.
And there's some key differences between those animal models and the real-life situations we see in humans.
Such as?
Well, for starters, the animal models typically use young, healthy animals who have ventricular fibrillation induced artificially.
Okay.
Yeah.
That's a very controlled environment.
Right.
Not quite like a human collapsing from a sudden heart attack.
Exactly. In real life, patients are often older,
Mm-hmm.
have pre-existing health conditions,
Right.
and have an ongoing cause for their cardiac arrest.
Yeah.
And resuscitation efforts start immediately,
Right.
often with cooling techniques applied as quickly as possible.
So it sounds like the animal models don't perfectly mimic the complexity of human cardiac arrest.
They don't.
Yep.
Plus, most animal studies focus on survival rates,
Okay.
not neurological outcomes,
Yeah.
which are a major concern in human trials.
Right. We want to make sure people are not only surviving, but also have a good quality of life after.
Absolutely.
Okay, that makes sense. So let's shift gears and talk about those human studies. What's the current research telling us?
Okay, so the first randomized trial in ECPR called the ARREST trial was published in 2020.
Okay. And what did that trial reveal?
They found a pretty amazing 43% good neurological survival rate
Wow.
in the group who received ECPR, compared to 0% in the control group who received only traditional CPR.
Wow. That's a huge difference.
It is, but it's important to keep in mind that it was a relatively small study with a very specific group of patients.
Okay.
2 larger randomized trials published more recently
Okay.
haven't been able to confirm that ECPR is definitively better than traditional CPR.
So the evidence is still a bit mixed?
It is. There are also registry studies and meta-analyses which combine data from multiple studies.
Okay.
They've shown some promising results,
Mm-hmm.
but ultimately we need more data to be conclusive.
Yeah, it sounds like we're just scratching the surface when it comes to understanding the full potential of ECPR.
That's a great way to put it.
Yeah.
It's a fascinating field with immense potential.
Yeah.
But we need more research to pinpoint the best candidates for ECPR
Yeah.
and to refine the technology itself.
This has been an incredible overview of ECPR.
It has.
We've covered what it is, why it's used, how it works, the challenges, the risks, and even touched on the current research.
We've covered a lot of ground.
We have. We'll be right back to dive deeper into the future of ECPR
Okay.
and explore some of the ethical questions surrounding this life-saving technology. Don't go anywhere.
Sounds good. Welcome back to our deep dive into the world of ECPR.
We've covered a lot of ground already, but I'm really excited to talk about what the future holds for this technology, what's on the horizon.
You know, the future of ECPR is brimming with possibilities.
Okay.
One of the most promising areas is the development of faster, more portable systems.
So instead of rushing patients to a specialized hospital, we could potentially bring ECPR to them.
Exactly. Imagine a system compact and portable enough to be deployed by paramedics in the field.
Wow.
You know, it could dramatically reduce that critical low flow duration we talked about.
That would be a game changer. What are researchers doing to make this a reality?
Well, they're working on miniaturizing all the key components,
Okay.
the pumps, oxygenators, and cannulae, to create a much more compact and transportable system.
So it's like taking all that life-saving power and shrinking it down
That's a great way to put it.
into a more manageable package.
Yeah, and these advancements could make ECPR accessible in a much wider range of settings.
Yeah.
From ambulances to rural clinics, potentially saving countless lives.
That's incredible. What other advancements are researchers exploring?
Well, we talked about the challenge of patient selection, right?
Yeah.
Figuring out who's most likely to benefit from ECPR.
It's a crucial decision with high stakes.
Absolutely. So researchers are working on developing better algorithms and predictive models to guide those decisions.
So using data to make more informed choices about when ECPR is the right call.
Precisely.
Okay.
By analyzing factors like the patient's age, medical history, the circumstances of the cardiac arrest, and even specific biomarkers, we could potentially create more personalized treatment plans.
It's like taking the guesswork out of the equation and using data to improve outcomes.
Exactly. It's about using the best available information to make the most effective and ethical decisions for each individual patient.
Okay. So we've got portable systems and predictive models in the works. What else is cooking in the ECPR research labs?
Another exciting area is the use of artificial intelligence.
AI, you mean like robots doing surgery?
Not quite robots, but AI could analyze real-time data from the ECMO machine
Okay.
to help clinicians optimize settings,
Okay.
anticipate potential complications, and make adjustments on the fly.
So it's like having a super smart assistant
Yes,
helping the medical team make the best decisions possible.
that's a great analogy. AI can process massive amounts of information
Yeah.
and identify patterns that humans might miss, making it a powerful tool in managing something as complex as ECPR.
It sounds like a perfect match for a technology like this.
It really does. AI has the potential to make ECPR even safer and more effective, and we're just beginning to tap into its potential.
All of these advancements sound incredible, but I know there are also ethical considerations with a technology as powerful as ECPR. What are some of the biggest concerns?
One of the biggest challenges is determining when ECPR is truly beneficial and when it might be prolonging suffering.
That's a difficult question to answer.
It is ECPR, as we've discussed, is a high-risk, high-cost intervention. And sadly, it doesn't always guarantee a positive outcome.
Right.
There are valid concerns about using ECPR in patients who have very low odds of meaningful recovery.
I imagine it's a delicate balance between offering every possible chance and recognizing when further intervention might not be in the patient's best interest.
You're absolutely right. And these are tough decisions that often have to be made in very time-sensitive and emotionally charged situations which adds another layer of complexity.
Yeah, it really makes you realize how much weight those decisions carry. What other ethical concerns are there?
Resource allocation is another big one. ECPR is expensive
Right.
and requires specialized equipment and personnel which aren't available everywhere.
So if ECPR becomes more widely available, how do we ensure equitable access? Not everyone can afford these cutting-edge treatments.
That's a crucial question that we as a society need to address.
Right.
As this technology evolves, we must have thoughtful discussions about how to prioritize patients and allocate resources fairly. It's about ensuring that everyone has a chance to benefit, not just those with the means to access it.
It almost becomes a philosophical question, doesn't it?
It does.
What does it mean to save a life? And how do we make those difficult choices when resources are limited?
You've hit the nail on the head. These are profound questions that we need to grapple with as this technology continues to advance. We have to consider the ethical implications alongside the scientific progress.
This deep dive has given me so much to think about.
It has.
ECPR really pushes us to think beyond just the mechanics of medicine.
That's a great point.
Yeah.
What's fascinating here is how ECPR forces us to confront bigger questions about life, death, and what it means to provide truly compassionate care.
It's not just about keeping the heart pumping. It's about recognizing the whole person and respecting their individual journey.
Exactly. It's about having open and honest conversations with patients and their families about their goals, their values, and what a good outcome looks like for them, even in the face of such challenging circumstances.
These conversations can be incredibly difficult, but they're so important to having a truly patient-centered approach.
I couldn't agree more. These conversations are essential to ensuring that ECPR is used in a way that aligns with our values and respects the dignity of each patient, regardless of the outcome.
This discussion has really opened my eyes to the complexities of ECPR, both the scientific marvels and the ethical considerations.
It's been a pleasure exploring these complexities with you. I'm excited to see how this field continues to evolve and what breakthroughs lie ahead.
Before we wrap up this part of our deep dive, I want to leave our listeners with something to ponder. We've talked extensively about the medical perspective, but what about the patient's experience?
That's an important point. We often focus on the technical aspects of ECPR and overlook the profound impact surviving a cardiac arrest and going through this intense procedure can have on an individual.
I imagine it's a life-altering experience in many ways.
Absolutely.
Yeah.
There are physical challenges, emotional challenges, and a lot of uncertainty about the future.
So for our listeners, here's something to consider. If you were a patient who had survived a cardiac arrest thanks to ECPR, what would your biggest questions be? What kind of support would you need to navigate the journey ahead?
That's an excellent question for everyone to reflect on. It highlights the importance of not just saving lives, but also ensuring that those lives are filled with meaning and purpose after such a traumatic event. It's about providing holistic care that addresses the physical, emotional, and even existential needs of the patient.
That's a powerful message to end on. We'll be back in just a moment to wrap up our deep dive into ECPR. Stay with us.
Welcome back to the deep dive. We spent this episode exploring this fascinating world of ECPR.
It has been fascinating.
From its mechanics to its, ethical implications.
Right.
It's clear this technology is pushing the boundaries of what's possible in medicine.
It really is remarkable how far we've come.
Yeah.
But as with any cutting-edge field,
there's always more to discover and understand.
That's a great point.
Yeah.
We've talked about the incredible potential of ECPR.
Right.
But we've also highlighted some of the unanswered questions and the challenges that remain. What are some of the key areas where research is needed to, move this field forward?
Well, research is the engine driving progress.
Yeah.
And in the world of ECPR, there's a lot left to explore.
Right.
And we've talked about the need for more data to understand who benefits most from ECPR, how to optimize the technology itself, and how to make it more accessible.
And of course, to address those important ethical questions that we discussed.
Exactly.
Yeah.
One of the most crucial areas for future research is conducting larger randomized controlled trials.
Those are considered the gold standard in medical research, right?
They are.
Yeah.
These trials allow us to compare ECPR to traditional CPR in a very rigorous, controlled way, which helps us understand the true effectiveness of each approach.
So we need more head-to-head comparisons.
Yes.
To really know when ECPR makes the biggest difference.
You got it. And these larger trials can also help us identify any long-term effects of ECPR.
Right.
We need to follow patients for years after the procedure to understand the full impact on their health and quality of life.
We talked about the potential for complications like blood clots or organ damage.
Yes.
Are there studies looking at those long-term outcomes?
There are some, but we need more.
Okay.
It's essential to have a comprehensive picture of the risks and benefits
Right.
so we can make truly informed decisions about when and how to use ECPR.
That long-term data will be crucial as this technology continues to evolve.
Absolutely.
What about those portable ECPR systems that we discussed?
Yes.
It seems like such a huge step forward
It is.
in making this life-saving technology more accessible.
It is a promising development, but before these portable systems can be widely adopted, they need to be tested in real-world settings.
So conducting field trials to see how they perform in ambulances or out in the community.
Precisely. We need to understand how well they work in different environments.
Yeah.
With different patient populations and with varying levels of expertise among the medical teams using them.
Right.
It's about taking those innovations from the lab and making sure they actually translate into better outcomes for real patients.
Right.
In real-life situations.
Yeah, it's exciting to think about the potential impact, especially for those who might not have access to, specialized hospitals equipped for ECPR.
Absolutely.
Yeah.
And alongside those technological advancements, we also need to focus on training and education.
That makes sense. If ECPR becomes more widely available, healthcare providers everywhere will need the knowledge and skills to use it safely and effectively.
Exactly. We need comprehensive training programs, standardized protocols, and ongoing support to ensure clinicians are prepared to handle the complexities of ECPR.
It's really a team effort, isn't it?
It is. And what's often overlooked is the importance of public awareness. The more people understand about ECPR, the more likely they are to advocate for research funding, support its availability, and even make informed decisions about their own health care.
So it's about empowering people with knowledge and giving them a voice in the conversation.
Exactly. And that brings us to another vital area for research.
Okay.
Understanding the patient and family experience.
Yes. This is something I'm particularly interested in.
Yeah.
What was it like for them to go through such a dramatic, life-altering event? What challenges did they face during recovery?
Those are crucial questions.
Yeah.
We need to listen to their stories, understand their fears and hopes, and learn from their experiences. It's about recognizing that ECPR is not just a medical intervention.
Yeah.
It's a profound, life-changing event that impacts the whole person.
And we can't forget about the families.
Yes.
They play such a vital role in the patient's journey, both during the acute phase and throughout that long recovery process.
Absolutely. We need to include families in the research as well.
Yeah.
What was it like for them to see their loved one go through ECPR? What kind of support did they need?
Right.
How did this experience affect their lives? These are important questions that can help us develop more compassionate and holistic approaches to care.
It's about recognizing that ECPR impacts the entire family system.
Precisely.
Not just the individual patient.
By gathering these perspectives, we can create a more comprehensive understanding of ECPR, leading to better support for both patients and their families.
This deep dive has been an incredible journey of discovery. We've explored the complexities of ECPR, from its, mechanics and potential to the ethical considerations and the human experience. What a fascinating and evolving field this is.
It's been a pleasure sharing this exploration with you. It's inspiring to witness the dedication of researchers, clinicians, and patients working together to push the boundaries of what's possible in medicine.
We've reached the end of our deep dive, but the conversation doesn't have to stop here. To our listeners, we encourage you to continue exploring, learning, and asking those thought-provoking questions that fuel progress.
If there's one key takeaway from our exploration, it's that ECPR is a testament to human ingenuity and our unwavering determination to improve lives. While challenges remain, the future of ECPR holds immense promise, and I, for one, am excited to see what breakthroughs lie ahead.
Beautifully said. Thank you for joining us on this episode of The Deep Dive. Until next time, stay curious.